Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Tuesday, April 28th, and this is my daily briefing. We've had a total of 41 cases to date in Missoula, so that number hasn't changed. 39 of those cases were identified by testing, and 2 were epi-linked. We've had 38 recoveries and 1 death, and that leaves us with 2 active cases that are currently in isolation. As of Sunday night, 1,760 tests have been done in Missoula County since the start of our response, and the state has had a total of 451 cases and 15 deaths. So I have a few different things that I'm going to cover today. A few people have asked why we didn't use the University of Washington's IHME model to make decisions on the reopening plan. I want to just again remind people that models are based on assumptions and the available data, and each model shows something a little bit different because each one uses different assumptions and different approaches, and none of them can be really viewed as a crystal ball that's going to predict what's going to happen. Something that I feel is really important to highlight is that this model looks at the number of deaths and hospitalizations and not necessarily the total number of cases that we should expect. Montana has had some of the lowest rates in the United States for mortality and hospitalizations. And the model also uses our data to date and assumes a continuation of social distancing measures like the stay-at-home directives. As these requirements are changing, that means that this model may not really reflect how things will look moving forward. Additionally, even though the IHME model suggests that relaxing of our current social distancing measures may be possible after May 6th, provided that we had adequate testing, contact tracing, and isolation resources, it's still April and not May 6th, and our ability to test is just now starting to get on track. So while we're not using this model to say that we're on the downhill side of COVID, the recommendations it makes regarding social distancing supports our local measured approach for reopening. We've had some other comments that I think deserve some discussion. First, there are younger people in our community who might think that this is no big deal for them. Granted, people who are in higher risk categories for COVID-19 complications are often older, but that doesn't mean that younger people are not at risk. Younger people are getting it, and they're getting hospitalized right here in Montana and even right here in Missoula. The state report last week showed that the age group with the most cases statewide are actually the 20 to 29-year-olds, and that is what we're seeing here in Missoula County as well. And over 1/3 of the cases in Montana have occurred in people 39 years old and younger. Missoula County has actually the youngest average age per case at 34 years of age. So what does this mean for you? It actually means several things. The younger group might be why we've had fewer deaths and hospitalizations in Montana, which is really good. However, this also means that the disease could be bigger than what we have the numbers to show. Younger people could have milder illness and not recognize it, or if they did recognize it, weren't able to get tested due to the resource limitations that we've had with testing. Further, this age group is often much more active and in contact with a lot more people. This could mean a lot of close contacts or spread, especially if the cases are not diagnosed. Something else that's important to remember, especially if you're younger and likely to get through COVID without complications, is that you can still spread this to someone who may not survive it. Another comment that we've gotten from a few people is that those who are afraid should just stay home. It's just really not that simple. For those who are vulnerable, they also sometimes work essential jobs or are now returning to work and don't really have the choice to stay at home. Those who can stay home still have to be concerned that their family members who are going to work or running errands can bring it home to them. This is why it's just really important to continue social distancing measures and to wear face coverings to minimize the risk to others, even when you are healthy or are not concerned. You could potentially expose an elderly customer or be exposed and bring the virus to your parents, your grandparents, or a child with an underlying medical condition. This virus is really just not an individual issue, but the risk to let me try that again. This virus is not just an individual issue. It's about all of us. So it's really important to think not just about protecting yourself and the risk that you might be willing to take, but the risk that others can't take. I also just want to talk a little bit about the symptoms. So the CDC has changed their list of symptoms that could be consistent with COVID-19. And so we've now expanded the list of symptoms that could qualify people for testing at our county testing center. In addition to cough, fever, and difficulty breathing, we've also added chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell, as those are the symptoms that have now been identified by the CDC. So I want to encourage any Missoula County resident or Missoula healthcare worker or first responder who's having any of those symptoms to please call 406-258-INFO. That's 406-258-4636, and select option number 2 to speak to a nurse. While an appointment is still needed, you don't need a prescription to get tested, and the service is totally free. Nurses are available to take calls Monday through Friday to get those appointments scheduled for you, so definitely please give us a call if you're having those symptoms. So that's it for my daily briefing today. It's a little shorter than it has been. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are posted. Follow us on Facebook for more information at the Missoula City County Health Department Facebook page. You can check out our website. We're always adding new information as it comes available there. That's missoula.co/cvirus. And if you have any questions or want to schedule an appointment, you can call that 258-INFO line. Excuse me. As always, stay healthy, and I will talk to you again tomorrow.